everyone. Thank you for joining us for AMTA Grand Rounds, Music Therapy Practice in a COVID-19 World. My name is Barbara Else, and I'm currently serving as a member of the AMTA COVID Task Force, and we are the sponsor for this Grand Round series. We hope you enjoyed hearing this submission to the AMTA COVID-19 Songwriting Contest as we gathered. That particular one was by a group of students. There's still time to submit your original song by October 15th. So visit musictherapy.org under latest news for the information. And we also encourage you to view the many resources on the AMTA COVID-19 webpage and reach out to us with questions. Before I introduce our presenter for tonight's Grand Rounds, I ask that you please keep yourself muted to minimize distractions for our presenter and the viewers. You can use the chat function to type in questions to the presenter, and I'll be looking for those questions. And we're going to have a discussion period after Joshua presents his topic and content, so we can have a group chat. So this session is being recorded and will be posted to the COVID-19 resource page. So today's session is called Putting the ISO in Isolation, Lessons from a 2-Year Quarantine. Today's presenter is Joshua Pearl, and I have the honor of introducing him. So we're going to travel over to Portland, Oregon, where he lives. So buckle up, put your tray tables in the upright and locked position, and we'll wing our way west over to Portland. Joshua received his music therapy education and training at Marylhurst. He also received degrees in piano performance and educational theory from Oberlin College and Conservatory of Music in 1989. He spent most of his 20s in Kyoto, Japan, where he studied traditional Japanese music and engaged in a variety of Eastern spiritual practices, including Zen meditation and tea ceremony. He was the founder and music director of Cross Currents, an interdisciplinary cross-cultural concert series in Japan, before relocating to New York City, where he played in Broadway orchestras and gigged as a jazz and cabaret performer and music director for several years. Joshua spent the next 12 years in Woodstock, New York, the real Woodstock, where he worked as a freelance record producer and holistic music educator at the Whole Musician Workshop. That's an organization he developed while raising a family, homeschooling 3 children with his wife, who is a fellow artist in her own right, Cora Pearl. In 2010, he relocated to Portland, where we've traveled today, where he currently works as a music therapist in private practice. In 2014, Joshua was diagnosed with pemphigus vulgaris, a rare life-threatening autoimmune skin disease. Thank goodness he's been in remission since 2016, and he's here today to talk about the ISO in isolation and share his experiences and hopefully prompt you with a few ideas too. Joshua?
Thanks, Barb. Yes, and thank you for everyone who's joining live as well as watching the recording. I was reflecting on my experience as a full-time patient living in actual quarantine because of a rare autoimmune disease, and I'm going to share more about that and some photos of what I looked like when my skin was falling apart, and how music and the ISO principle really came to my aid during that time. Before I did that, I just wanted to reflect for a second on this strange era we're living in right now. Call it what you will, the COVID era, our time of quarantine, things shutting down. There are a lot of angles on what's happening, and of course it's expanding into a variety of personal and societal breakdowns and opportunities depending how you're looking at it. But what it has in common with my experience back in 2014, 15 into 16 as a patient is that it is a time riddled with uncertainty. And my experience was nothing if not full of uncertainty. I had no idea how long my condition would last, and I really was not certain of the effects, especially for the first 5 months when I was unable to get a proper diagnosis. All I knew is my skin was falling apart, starting with my mouth and then spreading to my entire body. So basically I was looking at uncertainty physically, financially, professionally, psychologically, and socially. I just had no idea what my life was going to become, how long it would take. But I did have a very vague sense that it was not going to kill me and that I was going to emerge different on the other side. And as I share my story today, I invite everybody to pause if you're looking at the recording, or just take a moment and reflect on how you're doing with this time of uncertainty, doing your best to bear witness to your own experience. How is uncertainty sitting with you? And perhaps there will be some things from my own experience as a patient that will shed some light on some options we have around that. I want to say before I get into sharing any slides that even though I'm going to be talking about pemphigus vulgaris and autoimmunity and pain management, today is really a talk I'm giving about self-care. It's not about clinical applications of music therapy for pain management or modulating immune response or anything like that, although I would love to have the opportunity to do more research in those areas apart from my own experience. But the through line is the ISO principle, something unique as far as I know to our field, and something we all talk about. It's something we've all heard about in training, and I know for me it was introduced to me as a tool or a way of relating to clients or groups, a way of discovering and matching the musical qualities inherent in the situation. And as I've been in this period of isolation and looking back on my time with pemphigus, I realized how much the ISO principle was a guiding approach for me in dealing with everything from those uncertainties I mentioned, extreme full-time pain in my body, the need for bandage care, hygiene, all kinds of things. I didn't have the concept, the words ISO principle in my head at the time, but reflecting back, the ISO principle was really what was getting me through. So with that being said, I am going to share a little bit about the journey I went on. So are you able to see putting the ISO in isolation, this cover page, as a full screen right now? No. Okay, let me get it.
Not quite full screen.
Huh. Right. Slideshow, there we go. Okay, that should do it, right? You got it now?
Yeah.
Great. All right. By the way, this image that my wife found for me online was something I would just stare into while I was undergoing this experience of my body just falling apart. And there was something about these colors and the role that color played. There were certain colors I just wanted to be around. And these kind of sky, water, somehow vaguely suggesting an intertwining of DNA and relating, and the earth, and perhaps the role of medicine and angelic. It just really spoke to me at the time, and it really helped me ground myself and say, okay, you're a patient right now, let's do this. In other words, very early on I decided, better than resisting this or wondering how quick it was going to be till I could get back to my normal life, I decided to say yes to the experience. And that's because I had a personal history, and I call it my pre-existing conditions, that really set me up for a breakdown like this. I won't go through all the gory details, but suffice it to say, I was revving high with a lot of stress coming into my life from a lot of different angles. As Barb mentioned, raising a family while trying to make a living as a musician, also with a partner who was an artist. I was also part of the sandwich generation phenomenon where I was taking care of aging parents as well as young children. So lots of stress, lots of things that I was just really hustling and gigging in every way I could to make a living and get through. I'm fortunate in that I have a very privileged music education. This is Senmara Rushstein. She was my piano teacher at Oberlin, and really taught me, apart from piano technique, thinking about the piano as an instrument that was full of tone possibilities, not just a digital keyboard that you pressed, but a world of tones, something that would come back and help me when I was using music to manage my pain. As I mentioned, I had a lot of professional adventures and struggles, some successes, some highs, and definitely some lows. These are just a few examples of places that music took me in my professional life. I got to work on Broadway in the pits, as well as doing rehearsals for that, study jazz with Barry Harris, work as a musical director and pianist with Levon Helm when I was living in Woodstock, New York. And there are many wonderful chapters that I've been able to draw on. But yes, caring for aging parents was the other side of my life. While I was trying to just make it, things were falling apart in my parents' life, and I'm an only child, so the stresses were significant. In 2009, after the presidential election, I actually uprooted my family and we left the East Coast and took a very exciting but stressful journey to find our next home, and spent the better part of a year touring around the country before landing in Portland. And at that point, exhaustion really set in, and even though it took about 4 years for any physical symptoms to set in, I was certainly headed for some kind of a breakdown. And that brings us to pemphigus vulgaris, or as I like to think of it, Saint Pemphigus. A very strange condition that is rare. It's literally 1 in a million. It affects the skin, basically, as an autoimmune disease. It involves our B cells making errant antibodies that go and attack the skin connecting tissues. So any little sore that starts is registered as a threat. The antibodies come and they start breaking down the very healing process that's supposed to take place, which is why it starts in the mouth, because we get cuts and lesions in there all the time. But eventually it spread to my entire body. Needless to say, when your skin is falling apart, pain becomes a 24/7 companion. So I was basically walking around gradually with increasing amounts of lesions and eventually the equivalent of third-degree burns all over my body. I managed to stay out of the hospital, but had to basically make bandaging and skin care my full-time occupation for this period of time. I'm going to share a few pictures. I'll go through them quickly, but just to give you an idea of what it was like. My mouth, as you can see, pretty much went away. My lips and the entire inside of my mouth disintegrated, and I was barely able to eat. It would take me hours just to get a smoothie, half of a smoothie down, so I was down to about 114 pounds. I went through a series of misdiagnoses. I was diagnosed, at first it was considered some kind of a perhaps viral herpes. I was misdiagnosed with laryngopharyngeal reflux, lichen planus, all of these very pretty serious conditions, but none of them ended up being accurate. And as my symptoms progressed and I went through a series of biopsies, I finally was able to get the correct diagnosis for pemphigus vulgaris, at which time my job became clear: manage your pain and find a way to get your immune system to recognize that we're all on the same team here and stop attacking itself, stop attacking me. I went through a spectrum of therapies. I was very open because I was so desperate. So everything from pretty much middle of the road medical therapies. I was taking very high doses of prednisone, corticosteroids, if you have any experience with those, basically shut down a lot of the body's immune response wholesale. And so it's like calling off the dogs. It doesn't really solve anything, but it attempts to mitigate the symptoms. I was working with a nutritionist just to be able to get basic nourishment. It was a big trick working with my dental hygiene, given that my mouth was on fire. And then I was looking at some more esoteric approaches and spiritual healing modalities, including sound healing. I was reading and studying a lot about the relationship between our emotional life and the boundaries we put up in our relationships, and the skin as a symbol of perhaps feeling intact and well-bounded, working on all of that. And I was seeing a therapist just to come to terms, or attempt to come to terms with what was happening. I got a lot of emotional support from friends far and near. Eventually, a community came together and actually put together a fundraiser to keep my family sheltered and fed, because this disease, after a year, pretty much had wiped out every financial resource I had. And then the most extreme medication I took is a monoclonal antibody called Rituximab, and basically this comes in and wipes out every B cell in my body. And as those B cells regenerate, which they do in the bones, for some reason they tend to act differently than they did the first time around. So I went through a few different rounds of this, and this had a big role in eventually achieving remission in 2016. Now I want to just say a word about Psycho-Neuro-Immunology, because this was really where music started to enter the picture for me. I was looking at the interrelationship between what was going on in my immune system, what was going on in my nervous system, and all that anxiety and stress I had amassed for so long, and what was going on for me psychologically. And I found this book called Secrets of Your Cells. And it was written by a cell biologist who posited that our cells have some sort of intelligence or sentience, that we can actually communicate with them. In fact, they are sort of our oldest ancestors, and they live right here. And I thought to myself, what do I have to lose? Let me explore this, and let me try and communicate with my cells. How would I possibly do such a thing? And it occurred to me, perhaps they'll understand the language of music. I don't think I can actually sit there and have a conversation in English with them. And curiously, the author in this book talked about how the cytoplasm on the cell wall is stringy, sort of like an instrument. And as the pressure or tension on those strings loosens or tightens, it affects what type of genetic expression comes through. And I thought, how interesting. As we change the tension on a piano or a guitar and retune the strings, it's not just the pitch that subtly changes, but also the tone. So I just started to get into this whole musical, metaphorical conversation while I was in immense pain, right? So music became my daily medicine, along with pain medication and immunosuppression and all the other things I was doing. I would come to this piano, and the piano you're seeing, actually, you can't see it in the camera, but it's right here in front of me. And I was very fortunate to have a piano very rich in overtones. And I'm just going to give you a sense, if you can hear it there. It's piano. Gave me a lot of tonal worlds to work with. And I almost started to look at it as a pharmacy, a tonal pharmacy. What tones are going to speak to my pain and to my condition? And of course, pain was the most immediate, so I was drawn to dissonance on the piano. Specifically, I started realizing that the very interval of a half step and the rub that occurs with that dissonance, somehow it isoed my pain. And when I would just play those two pitches and close my eyes and listen, it made me feel better. Again, I didn't have the term ISO principle. What was happening was I was isoing my pain. And that rub and that dissonance just felt like the music was saying, I'm with you, I understand you. Now, while I was doing this, I found very specifically on the piano this is an F and an F sharp. This was the first interval that worked for me. I then went up and I did the same thing with a B flat and a B, and I felt a similar sense of, of dissonance resonating with my pain. Then I put these two together, the F to F sharp and the B flat to B. And I would just live in these four tones. And somehow in them I heard the dissonance, but I also heard something rather soothing. And I wasn't sure what it was, but as soon as I put a B, because again, I was experimenting with communicating with my B cells, I thought maybe they have a humor, and if I play in the key of B, I'll reach them. So I put a B in the bass. And then I started to hear it a little differently. It was actually, there was some consonance as well as dissonance in there. And it reminded me almost of like a traditional Indian raga. And it eventually turned into this pentatonic scale. And I would play with this. And I did have some experience working in classical Indian music, not a lot, but enough to recognize there was a quality that was soothing me. And then as an experiment, I shifted what was in the bass to an E flat. Still the same pentatonic scale, but very different, a little more tense, a little more dramatic. And then I'd go back to the B in the bass, and I'd go, ah. It was almost like the two sides of pain, drama, tension, anxiety, and a place of rest. And I developed this practice, this routine where I would sit at the piano every day, start with these intervals, and improvise. I had no ambitions to compose or do anything special. I was just dealing with my pain. In fact, the fact that I didn't have any other agenda, there was no project or deadline, was so liberating for me because I spent so many years relating to music as my career, and now I could just relate it to my pain and start to really find it to be my daily medicine or part of my daily medicine. So it was a paradox. I was in excruciating pain, but I was finding actually quite a bit of happiness emotionally and peace psychologically in the midst of this. I also experimented with sound healing. There was a woman who had worked with crystal bowl healing who had been coming through Portland, and I ventured out of my quarantine state to check out her workshop at a nearby bookstore and invited her to come back to Portland and treat me as well as invite others into my space. So we actually, while I was still in my illness, had a sort of a healing circle using these bowls. And that is another topic, and I know sound healing is of interest to some of us in music therapy. But I just want to give you a sense of how my relationship to music was being transformed by my experience as a patient. I mentioned the gift of tone. And as I was doing this, without realizing it, color, sound, people who were loving, there were all of these things that I was starting to carry around with me. And in a sense, to make it through the day, this was not just a sort of a half-hour a day thing. This was a full-time, I call it like I created a shrine, I created a ritual out of everything. This was a coping mechanism. This was not a spiritual pursuit. This was a way of dealing with pain, intense skin pain. But I found that there were certain colors, amber, the smell of beeswax candles, certain people, knowing they were there, again, the music. And I wouldn't just play the music, I'd record it and I'd listen back throughout the day, especially when I was bandaging and things like this. It was like I was swimming in this healing bubble, and this was my approach. But what made up that bubble was really all a reflection of the pain I was in. It was all one big ISO bubble. So before I go on and kind of complete my story of being a patient, I want to go back and invite you, as you're listening to this, to think about your own experience during this era of COVID and how you may be experiencing uncertainties in your professional life, in your personal life, in your physical life, and what types of musical, therapeutic, sensory, interpersonal personal, spiritual, what types of practices could you imagine forming as a way of moving through the day, not just hoping we're going to all get through this, but really embracing it as it is, which I think is sort of at the root of what ISO is. It's saying yes to what is. And I think the greatest gift I gave myself when I was going through this was I didn't see this as separate from the rest of my life. I thought that this is happening, and what is the whole purpose of life if not to heal and grow, whether it's explicit as it was in the case of my skin disease or implicit in the struggles that I'd gone through for the years leading up to my skin disease. And that is basically my origin story of becoming a music therapist, as well as my journey through a really trying time in my life. So with that, I will open it up to Barb, or if anyone has any thoughts or questions, I'm here to, take it.
Thank you, Joshua, for sharing that very personal and important story. I know we've got a couple people on, and we welcome your questions in the chat box, but I have a couple questions. I took some notes while you were talking too, or just jotted down a few ideas. I noticed that you talked about the sense of making a 360 shrine that is focused on the ISO in isolation during your illness. You talked about drawing upon philosophical and spiritual approaches. Can you talk about that a little bit? Because I know you have an affinity and a lot of experience in Japan, and I wondered if that played a part for you.
It played a huge part. I think one spiritual practice that really spoke to this is Japanese tea ceremony. And for me, my understanding of the ritual of tea ceremony is it's a practice to, as they say, find the universe in a cup of tea. It's to take big issues and big experiences and look for the microcosmic elements of them, to actually go smaller and smaller and smaller. So in the course of a Japanese tea ceremony, you don't just drink tea. You spend time looking at the cups. You spend time enjoying the aromas. Every element of preparing the tea is choreographed, and it becomes a meditative practice. And I think that had a big influence on how I was to approach things like, say, changing my bandages, okay? I wouldn't just go in the bathroom and be like, oh God, time to go through this ordeal, right? I'd light a candle. I'd lay all the bandages and ointments out. And doing it this way, I got to experience nuances of my own pain. For example, when I would take a bandage off, it would be incredibly painful. But I could track the arc of the pain. And I could almost identify, okay, it's on its way up, it's on its way up, it's peaking, and the peak has left. And now I was still in pain, but I started to recognize shapes to the pain and cycles to the pain, and I started to relate to it much the way we relate to tea in tea ceremony. There's so much in there. It's not a singular experience. It's rich. The other spiritual concept and practice, and it also comes from traditional Japanese culture, is actually on this framed piece of Japanese calligraphy behind me. This is Ma. It is the character for Ma. Ma is used across the arts in Japan, and it means different things depending what art you're studying. In the visual arts, it's translated roughly as negative space, the space in between things. In music, I like to think of it more as like the pregnant pause or the rests in between the notes, right? The emptiness, the space, letting things breathe. So in my pain management, I found that I could apply Ma. I would let the pain have some space to breathe. And I imagined, because I had no way of knowing, that maybe this was going to also have a subtle effect on my immune response. That by loosening the hustle that I was so used to in my professional life and letting this whole thing express itself and somehow not being in a rush to get out of it, that it might open up, crack open, and reveal things. And that's kind of what Ma is about. And if you're interested in the concept of Ma, I've actually written an article about it, and I believe we're going to be able to post a link to that on the website where you're accessing this.
Right. When the recording goes up, we're going to try to get that link for that article. I had the privilege of having to read just before the session, and it's well worth having a look at. Joshua, thank you for those comments. You know, you talked about your training as a professional pianist at Oberlin, and I'm a woodwind player, and I've got about 60 flutes in the house. And the tonal quality that you talked about piano, and Andrea's a pianist and a vocalist, and I'm sure you all have other major instruments that are listening to the Grand Rounds. But I have spent a good deal of time experimenting with bending pitches, particularly on these kinds of flutes, in a jazz format. And I know you do a lot of jazz too, in performance, to get in between that space. But the metaphor and the parallel to our practice as music therapists, when we're working with a patient in acute pain, we are focusing our attention on them and their ISO experience and getting up to that peak of dealing with the bandage if it's a burn patient or whatever that patient may be that you're working with. But you were pendulating back and forth in that role for yourself.
Yes.
You were practicing the ISO for yourself. And quite a bit of discipline for that, and the ritual involved in that for all the bandage time you had to do every day just to prevent infection, because you could have been in the hospital so easily, was remarkable and laudable for sure. What ways do you think you'd look at and consider ISO during isolation now that you're in remission in your home life and practice? Because you did talk about a journey through life at the end of your talk. Can you talk a little bit more about that? What you've taken away from that into your everyday life and your music therapy practice?
Well, it's really come back to me during this period of global, retreat of sorts. I'm an extrovert by nature. As a performer, I was always getting my energy by being out, gigging, playing with others, and all of that. So when I went into my role as patient and had to spend all this time away from the world, it was really a shock, and I had to really focus on my relationship with myself in a way I never had, despite the fact that I had a connection to these spiritual traditions, which do have an element of introspection and contemplation to them. I never had to spend that much time with myself. And so, when we're looking at domains, occasionally we talk about the intrapersonal, not that much, but there are many parts of ourselves, and there are many relationships within ourselves. And those play such a big role in how we're doing all the time. And so I look at that period as a time where I went on retreat, an intrapersonal retreat. I got to get to know myself. Physically, I got to know myself in ways I never would have imagined. And then, of course, these confrontations with my own reactivity to pain. I just spent so much time getting to know myself. So once I went into remission and, my more neurotic parts reemerged, and I was just starting to become a regular person. Not that that happened overnight. There was a very messy in-between phase, especially once I was tapering off of prednisone, and I was experiencing the severe drop of energy, and for the first time, depression and lethargy. That was a rough patch that lasted a long time all by itself. But once I was on the other side, I now had these new relationships. I had these intrapersonal relationships that I'd worked on and developed that I never had to before. And those have really stayed with me. So when the mystery of COVID emerged, in early spring, and things started shutting down and we couldn't gather in groups and I couldn't go to my various sites in the field and work with my clients, it was a very interesting return to the same state, except this time I wasn't doing it alone. This time everyone was going through it. So in a very strange way, it felt like, okay, you know how to do this, and I didn't feel as isolated in it because I was sharing this very strange and sudden shift with literally the entire planet, all of humanity, or almost all of humanity, which is, of course, an impossible thing to wrap my mind around. But So I think it balanced out my extroversion. It certainly balanced out my tendency to just, go for it past uh, past the point of well-being, my own well-being and self-care. And it was the perfect setup for being clinically trained, because once it was time to now learn how to keep my focus on clients and patients and really be 100% there for the other, I had my own experience of having been a full-time patient so close to the surface that it was just right there for me.
Right.
Yeah.
You said, I knew you were on huge doses of steroids, prednisone, and so forth before you had the monoclonal medication. How did your ISO 360 shrine adjust, knowing that your sleep pattern was probably totally messed up? I know you had much higher energy because you're on the steroids. But
Right.
were you using music or some of those tools to normalize sleep, or did you not worry about it during that time?
Um, it was, to me, it's funny to separate it out because meds, music, love, self care, meditation, these were all different facets of what was a very sort of Piscean, oceanic, very womb like experience. Certainly at the time, they weren't separate at all, they were incredibly fluid. In terms of sleep and energy, being on high doses of prednisone meant I didn't need as much sleep, and because I couldn't really eat much, I had a ton of energy because I wasn't digesting. So between the meds and that, and I think
Wired.
yeah, but it really contributed to my positive attitude because believe me, I am not like, I mean, yes, I have an optimistic bent, but I am not Pollyannish. I'm really into looking at gloom and doom. And so I kind of surprised myself when I was able to take this on with such positivity. And I have to imagine that all that extra energy from the prednisone and not eating helped keep my spirits up, even though that wasn't their purpose.
Right. It was an externality of those myths. Yeah. You talked about you improvised every day, right? For what, 100 days or so?
Yeah, I found out after the fact. I went back and I looked at, because it wasn't every day at first, and it didn't end up being every day. But there was a period where it was every day, and I went back because I recorded every day and I tracked all of that music, and it was exactly 100 days, mysteriously. And while it was improvisation to start, in fact, I shared with you how it started. It gradually, by recording it, listening back, returning again the next day, returning, compositional form actually started to emerge out of these improvisations. And so this was one section, sort of this free floating section. And then there was another section that was just the confusion section, where it was lots of, things just like fragments of chaos. And then after probably 80% of the form revealed itself, there was always this coda that I like to call the musical hug. It was at the end, and it just, everything would stop, and using, again, the same modes and same scales, it became this. Anyway, it went on from there. So each movement of sorts started to take on a personality, and I loved it when I get to the hug. And it just grew out of this, dissonance and these four pitches, and then a mode, and then a pentatonic scale, and this thing. But yes, and it's a concept that I've used in my practice. Basically, if you improvise on a regular basis, composition comes out organically rather than superimposing a compositional form. I found the composition started to reveal itself almost the way, if you look at one of those 3D puzzles and you see all of this chaos, and then you relax your eyes and some picture starts to form. And that's what it felt like.
Yeah, I'm not the composer, I'm the arranger. I'll get music from my jazz combo and then I apply the theory on the back end on what we created. So, oh yeah, that was that mode we were working in there. Yeah, that's pretty cool. I'm really looking forward to taking a listen to the compilation. And the lesson I have, even though I do a lot of jazz myself, for any of us on the call and as music therapists, whether you're paper trained as a classical musician or you're really into jazz, it doesn't matter. But to do what Joshua did in his hug music, I call it the pearl hug that he just played, improvise for yourself is a liberating element. No judgment, just do it for yourself, for your own caregiving and whatever your needs may be. Because that's what this session is all about tonight. It really is.
And not doing that, as I didn't do it for so long. I was making music every day, and I think a lot of therapists can relate to this, right? We are making music, in a sense, the musical itch is being scratched because I'm out and I'm playing for my clients and groups. And I can forget, this is a completely different thing. This is sitting down with my instrument, forming this bond with the instrument. It's here just for me and I'm here just for it. Is so nourishing, and I think I was so thirsty for that for so long. So once the opportunity arose, and I think periods of isolation are when the opportunity is so ripe, because we didn't ask for isolation, it found us, right? If we're there. Yeah.
Right. Are you seeing clients now, Joshua, or is it quiet practice? Because the reason I ask is, how is your experience in the 2 years in quarantine translating to interventions in the way you approach your clients in your private practice?
I am currently working with clients remotely, over Zoom primarily, and isolation, of course, first of all, isolation, I think, is part of almost any client's experience on some level. If there's something, if there's something indicating therapy, any kind of disease or any kind of pathology, you're in a separate category by being a patient or a client. So you're already experiencing isolation, even if it's small and implicit. But of course, working with people remotely, there's this palpable sense of isolation, right? You're so far away. I'm so far away. We're in our own bubble. How is music supposed to address this? Very differently than when we're in the same room, sharing acoustic space, right?
Right. Just being online in Zoom, to apply Ma in the in-between spaces, we can't overtalk on each other. And just with our clients, I've had to adjust my pacing in between.
Right. And in a weird way, Zoom forces us to pause and listen. Because if we talk over each other, our signal will usually cut out. And of course, anyone who's tried to make music over Zoom knows that a whole host of difficulties show up pretty quickly. I can't wait to work with clients in physical proximity. I'm sure many people feel that way because there's something about music that really can't be replicated in distance, is what I believe and what I'm finding. But since we're in this, again, saying yes to it and looking at the Zoom or the remote telehealth experience and saying, can we find some opportunities that might not occur to us when we take for granted that we can make music together? And certainly the first one to occur to me is, I'm listening and I'm waiting for you to finish whatever you need to say or present or play. And you're probably going to do the same thing for me. So it's a strange sort of, we're going into retreat together sometimes is what it feels like. Or we're in retreat together.
Yeah, and Ma, the negative space, from a visual arts point of view, that pause when we're online doing telemusic therapy is that space in between. So there we're welcoming the tacit, so to speak, in the moment, as opposed to fighting it or being frustrated with it. I wanted to leave a couple minutes to make, in case any of our listeners that happen to be online with us right now have any questions. So if you do, feel free to unmute and or type your question in. We'll be happy to entertain it with Joshua before we wrap up. Meanwhile, if you're thinking about that, I would hope that you might be able to give us your takeaway, Joshua, on or tips, advice you have for music therapists, music therapy students who may be struggling with isolation, or they may have family members, children coming in and out of school or hybrid learning, struggling with it in their own home bubble that you would want to share.
Absolutely. Well, first of all, for those who are not struggling, wonderful, because perhaps you've already found a way of spinning your experience into an opportunity, and you're energized and finding value in that. But for those who are experiencing worry, distress, disorientation, anxiety, all the things that kind of go with the experience of being thrown into a sudden, uncertain set of circumstances. I'm going to give you the same advice I'm giving myself sort of every day based on what I experienced when I was a patient. First, make a decision. That's something I did. And the decision was completely not evidence-based. It was faith-based. It was personal, it was self-care based. And the decision was, this is not the final chapter. Whatever this is, and I don't even know how long this chapter is going to last, there is going to be another chapter. And had I not made that decision on the front end of my illness, I think I would have invited a lot more suffering. So if you can muster it up, just decide there's going to be a post-this, a post-COVID, a post-pandemic chapter at the very least. And the fact that we can't say when it will be or what we're going to have to go through to get there doesn't take away from the importance of holding it that way. That's one. Then growing out of that decision is, well, since we're in this, and since it's temporary, let's see what this baby can do, rather than continuing to use a normal life as a reference point. Let's say, well, since it's not going to last forever, I better take advantage of this. That's exactly what I did, and why I was able to grow so much through it and learn so much and be changed by it, because I didn't want to miss the opportunity. How many people get a chance to be, in quarantine for 2 years in utter pain, but not be depressed? And actually all my inner organs were fine, right? It was a very strange disease. I didn't have any internal problems. It was all on the surface, symptomatically on the surface. And the cause, of course, was in my bone marrow. So it was this paradox. It was being caused at the deepest levels of my being, but it was being presented at the most superficial levels of my being, and everything in between was fine.
And the Pearl musical hug that you played, we'll ask you to play it before we close again, that reached both of those spectrums from the left hand on your keyboard all the way to the top.
Yeah, the music really did do that in a way. It was like, it went so deep for me, and also I just like listening to it. It really, it worked on a sensory level as well as a deep emotional, spiritual level. So
we have someone on the call who is on vocal rest because they had some surgery and can't talk, but they wanted to thank you for sharing your story and hearing how you took the time to bring music into your own care and found a way to turn some of the monotony of your care into more of a ritual is an important reminder for all of us in our own lives and for our clients. Some of the ickiest things can be reframed, especially as we are all going through a trauma. And obviously she's on vocal rest from surgery, trying to recover from that. You're right. Sometimes, she says, playing music with our clients, quote, scratches the music itch, unquote. But we also need our own music. So thank you so very much, she says, truly, Joshua. That was lovely. Thank you.
Thank you. Thank you. Yeah, and again, just framing it, making the choice. This is not eternal. This is temporal. This is temporary. It might be long, who knows? But long, short, it's not the final chapter. Of course, we can't know such a thing, right? No one knows. But I found somehow the agency to decide just for my own well-being, that's how I was going to hold it. And I think that really opened up. Had I held it as, this may be the rest of my life and I may never know another day without this, I don't know that I would have been able to really take the gifts that it had to offer. And so I think it can be hard sometimes, especially because COVID has unleashed a variety of crises, and some of them are really, they're all very real and they can be terrifying. But there's that piece of hope, and even more than that, a choice to act as if this is not going to be the final chapter. That really helped me, and I think that can help. That is helping me to hold this time as well, definitely.
Thank you, Joshua. I think what we'll do is I'll make my closing remarks and make a real quick announcement, and then we will pass it over to Joshua to close us out with a minute of music, either the Pearl Hug or whatever ISO floats his boat on that beautiful piano that he plays on every day. So I do want to thank you so much to our presenter, Joshua Pearl, for this session, and thank you to everyone who's joined us today. Mark your calendars and join us next week. We've got on October 15th at 9 p.m. Eastern, Alexandra Wilson is a music therapist, going to be speaking Going Offline Online, Understanding Fear, Trauma, and Resilience with Technology. We'll look forward to hearing her do that next week. Stay safe and well, everyone, and I'll pass it to Joshua. Thank you, Joshua.
Right. So I'll just play for a couple of minutes, but I'll give you a taste again of those two sections, the sort of drama section, the relief section, and how they kind of led up to the hug. And again, this was probably in the last 20 or 30 days of that 100-day process that it finally kind of locked into this form. Thank you so much.
Thank you, everyone. Good night.